Hello, anatomy fans. This is Insomniac Anatomy Academy, where I can't sleep and study anatomy, and then I tell you the best parts. It is episode 33. Does anyone hear of scoliosis? I do. It is a lateral side-to-side curvature of the spine. You can see it here. It's the thing they make you bend over in your underwear in the school locker room to test in middle school. The thing school nurses live for some reason. What's wild is that this isn't actually just a side-to-side curve, which is usually kind of what you see in images. The vertebrae actually twist. You can see that a little bit in this picture, toward the cavity of the curve. So if you have, say, a twist to the left, like I do, your vertebrae just kind of rotate in a little bit toward the right. About 2 to 3% of the population have scoliosis of some degree. You can have either an S shape, which sort of self-corrects, or you can have kind of a C shape. What causes scoliosis? In 80% of cases, we have no idea. Not a clue. Yeah, or rather, we can see it. In my case, for example, my right leg is actually longer than my left leg. But why did it happen? Bodies, man. In many cases, doctors just monitor and say, well, you're gonna have back pain, I guess. Thanks. In more severe cases, and I've known a few of these, a poor kid is placed in a gigantic exterior metal or plastic brace, which tries to hold the spine and kind of convince it to grow straight. Think orthodontic headgear, but for your back, and you have to wear it all the time. Luckily, the plastic ones these days are much more low profile and you can hide them pretty well under your clothes. In the most severe cases of scoliosis, they will actually go in and fuse your spine. This is because the turning and the twisting of the spine here can result in a hunch, which, I mean, okay, but that hunch severely restricts the lungs and the thorax. It can be really, really rough. It can restrict breathing and your ability to move. But for more mild cases, like mine, they do other things to even out the spine and fix the curve. So in my case, I have a little lift that just goes in one of my shoes that makes my legs the same length. Poof, done.